Welcome, Dr. Samarth, to MSMF Will Grow Bionest project. We are happy to host you for this conversation.
Thank you for inviting me. I'm happy to be here. Thank you.
My first question to you, Doctor, is what are the opportunities that you feel entrepreneurs should pursue in the medtech domain? What are the upcoming areas where you see a lot of opportunities?
I have been associated with healthcare since the last 10 years. And one of the things that's strikingly changed over the last 10 years is now we're moving more and more into AI-based medtech. That wasn't the case in the early 2010, 11, which was more of devices and low cost and things. But now we are moving more into AI-based medtech technology. That's the biggest difference that I see in the medtech domain.
Any successful technologies, enterprises that you would want to speak about that you've seen creating similar kind of an impact?
Yeah, I mean, early days it was more about diagnosing in radiology primarily. But now we have AI-based technology employed for, again, they're also trying to go back to the earlier motto of bringing in low-cost development, so something that can be taken out of the hospitals to rural areas, and that kind of benefit-seeking technology. The recent times, I think, Dr. Yeah, you'll be editing this, right?
Yes, I will be. Okay. You could restart the second.
Okay. All right. So yeah, going back to AI-based technology. So like I said earlier, we were looking at low-cost technology, and now that's the same thing is being done with AI-based. So one of the recent ones we had encountered was diagnosing tuberculosis with just cough analysis. That algorithm, I think they had very good results and the technology was promising. And me specifically, because I see a lot of TB cases coming up now, and the symptoms are very, very atypical. So you will not see the old symptoms of always having a cough. And, you know, these are patients who look very well, but have TB for some reason. So in this technology, something like this can be very, very effective in a community scale. So the impact is much more.
Moving to my next question, how should entrepreneurs test the product ideas to launch faster in the market? Are there any recommendations that you have for entrepreneurs to go out and test their ideas? I feel they have to interact more with the end users. That's one of the main things that they need to focus on, because you may have the best technology, but the end user should be comfortable using the technology. And also, you have to make sure if it's relevant, because it may be a clinical problem that you feel is important, but it may be something that is not of importance to the doctor or who's using it. So they need to engage with the clinicians at a very early stage so that when they come out with a product, it's more attuned to being ready for the market and to the end user. And I think now the barrier between the medical fraternity and the engineering it's almost not there. So it's very easy to interact. A lot of doctors are involved in technology who are much more open to using technology. So that initial barrier is lost, and entrepreneurs should make use of this opportunity to interact more with the end users. At which stage should an entrepreneur start involving clinicians to take their advice to develop a robust and scalable product?
I think right at the beginning, even before at your ideation stage, if you have access to clinicians, not just working in big hospitals, who are working in rural communities,
So you need to speak to as many people as you can to understand what the problem is and what are the challenges that you're trying to address using your technology. So in my opinion, it should be at a very early stage.
How, how can entrepreneurs understand the hospital ecosystem and do business with it? Are there any tips on this?
Yeah, hospitals work very differently from your standalone clinics or peripheral units. So again, in hospitals, you have different categories of hospitals. So you have these large hospital group and networks. So they operate very differently, where their the business works in a very different way as compared to a hospital which is slightly smaller, or a hospital in a tier 2 city, for example. So each of them look at business in a different way. And of course, healthcare is, it should be sustainable. So, so whatever technology that comes in, it should help them to increase their profits in a way, not necessarily doing the wrong thing, but something that they were able to do with, say, earlier with 100 rupees, they should be able to do it at a much lesser cost. Then comes the second thing about scalability. So if you have a group which has many hospitals around the country, the technology should be so robust that you should be able to implement it across all the chains.
BioNest is a unique project where we have three important stakeholders: MSMF, Narayan Rudralaya, and Wilgrow.
Yeah.
What do you think is the benefit that incubator like this can provide to the entrepreneurs?
Yeah, that's a very good question. But I got to know about BioNest and this partnership quite recently, and it's a fantastic platform for any entrepreneurs, because at one stage you have Mazumdar Foundation and Narayana Health, which is one of the largest and very well-known healthcare providers in the country, and Wilgrow. They have done a fantastic job over the last 20 years in mentoring and supporting startups. So it is the right platform to get connected to all your needs in the healthcare domain. So that way, I think it's a very good initiative.
Thank you. Now I'll continue with the rest of the questions for a different purpose. Again, as I mentioned, it might sound repetitive, but would request you to share your opinions on the same. My first question is, how does a
do I have to give an introduction? Arun is saying you can do it at the end also.
Sure. I think we could first start with your introduction, sir, so that we could record that in the start.
Okay, fine. Hi, I'm Dr. Samarth Shetty. I'm a craniofacial surgeon working at Mazumdar Shaw Medical Center. I've been in the healthcare domain for over a decade now, and I've been fortunate enough to be involved with a lot of startups for the last 10 years. I think the startup environment in India is just getting better, and with more support from the government and a lot of private players, I think we are looking at very bright days for startups. I'm happy that as a clinician, I get to benefit from all these innovations, and I look forward to a lot of interesting and innovative ways of changing my clinical practice in the future.
Thank you. Great. My first question in our next segment: how does a hospital-based incubator add value to an entrepreneur?
If you walk into any hospital, of course, these COVID times are different, but on a regular time of the year, hospitals are very, very busy places. And in India, unlike the West, where a certain amount of time is allocated for clinicians for research, or so the work times are very fixed. But in India, there's no such thing. So work continues throughout the day and even after you go home. So for a doctor to invest time and thought to guide an entrepreneur or even to share his experience is a challenge, even for the doctor to give his time, and similarly for a entrepreneur to even engage with them and try to understand the problem. That is a big challenge. So, sorry, what was the question? Yes, yes. So, I'm sorry, you can edit that bit. So what I was saying is, that is the biggest barrier for people to just engage and have a conversation and try to understand. So if you're based in a hospital, it's almost like you're within the system. So it becomes more easy for you to not only talk to the doctor, but you can also see how it actually functions. And like I said, the dynamics are very different in every hospital. So unless you are on the site, on the ground zero, you don't really get a sense of it. So that advantage is there when you're based out of a hospital.
Great. My next question is, what specific clinician research support can the entrepreneurs expect from a hospital-based?
Once our entrepreneur enrolls into this program that we have, it automatically opens them with access to the clinicians and to the hospital environment. So even without really taking the first step, they get to interact with a lot of people, attend the usual regular activities of how doctors conduct their business. Apart from that, we also have infrastructure that allows them to develop their initial prototypes, prototyping labs, the engineering. They can speak to the business people to get some mentorship on how to position their idea and take it to market.
Super. Third, how is a clinician's advice useful in the entrepreneur's innovation?
Clinician will be the end user of the technology usually, and with the way medical practice works is it is incremental. So you have a certain amount of knowledge when you finish your primary degrees, and then over the years as you work, you kind of gather more knowledge on what works, what doesn't work, and how things should be. So a lot of clinicians have a lot of ideas themselves, which they're not able to execute. And that they can impart to the entrepreneurs who can implement it. So you get not just the clinical knowledge, but you can also get an experiential knowledge from the clinician.
Great. My next question, as a clinician, do you have any specific advice for entrepreneurs? Are there any areas where they usually go wrong and that can be avoided with the help of your advice?
There are two types of entrepreneurs. So some people are very passionate about something they want to do without really understanding how much of how effective the technology be, or how useful it will be at the end of it. I've seen that a lot of times you see that the same technology is done by so many other people, and because it just appears like a low-hanging fruit, and their previous background through their PhD somehow enables them to carry out that work. And people just do the same thing over and over again. So that is one group, and it's really hard to tell them that this is very common and it's been done, and you probably will not have a very successful outcome because they just want to give it a shot anyway. So that's one group, and I don't know what's the right way. Maybe somebody from the business, they need some more mentoring from the business side of it so that they get educated on if it's all worth the effort. So that's one group. The second group is of course, who believe that technology is the only thing and there is no role for the doctor or the clinician. So they just believe that just because the technology is there, people should start using it. So that is totally the other extreme of entrepreneurs, where they don't want to listen to anyone. They just want to do what they feel like, no matter what. Again, the bioness should make sure that they interact with such entrepreneurs more, so that they understand and the effort is not wasted.